This is as far as I can scoot it.
Whoa. Whoever sits here.
Heidi and Jenny, are you on?
I don't know who, there's some bills here that need to go to Heidi. Well, maybe she take those back.
We're logged in, but I don't know. Text them.
From this one, yeah.
Commissioner Storley and Commissioner Dukirk, are you
I'm just gonna log out of my
on the phone? Can you email Rena if you have anything in front of you and let us know if you can hear us?
Yeah, no problem. So I'll put this back on. No, don't worry about it. You never know what chords are gonna be down here or not down here.
Thank you, Sarah.
There you go, Bruce.
Thank you.
Well, we're logged into the thing, so. I'll go
Oh,
call.
we have a quorum.
You do have a quorum, so.
Well, once.
Who's the vice chair?
David.
David,
No,
do you want to do it?
I don't care. Ken.
Somebody beeped.
Anyone on the telephone?
Roger can run it, he's in charge of the health department. We don't get no. Morning. Sarah, do you have any agendas?
Are you?
I didn't bring my cheaters with, so.
I got you covered.
Thank
There
you.
go. Go, Myron.
I'm fine, I printed it out.
I got one, thanks.
Unless anything, something has changed.
I don't think so.
Do you want to give me the cooperative agreement and I can sign that one too?
Sure. So I just gotta stamp.
I don't have a pen. It's all right.
You sure?
I'll sign it when we get back upstairs.
Okay. I'll take that one to Andrea anyway, get her to stamp it.
I gave her a heads up. I gave her a heads up that we'd be asking for this.
Sweet. Should I stamp Linda's thing too?
Rena says to start, she says Heidi is driving down and she's trying to get Ginny connected.
Okay, so I think our first order of business is to actually select a chair to start the meeting. So I think in the protocol is that if the chair and vice chair are not here, then we should select, for those of us that are here in a quorum, select who would like to chair this meeting. Anyone volunteering?
I think that I would be a poor choice.
Then I guess I'll go ahead by default.
You can do it.
Okay. We'll call this meeting to order. Sorry for the delay. We're having some technical problems, but I think it's appropriate at this time to really thank all the people in the county that have been working very hard in dealing with this business as not as usual in dealing with the COVID-19, especially Grace Ganader, who is our public health coordinator, has been on call, I'm sure, all the time. I know yesterday we had a meeting of some of the leadership staff, and I know that our county attorney and our interim administrator have been working very hard to see how we can conduct county business. And you're seeing it live now if you're watching how we're trying to operate, and we're by law, I guess, according to Attorney Hicken, that we can conduct our meetings with commissioners that are telephone conferencing in, and we're just trying to deal with those technicalities now. But a special thanks to everyone, especially our employees, but also all those people in the public for working together to try to deal with these serious issues about our health and our economy. So with that, I'll call the meeting to order, and we'll go on to proclamations on the agenda. Social Work Month proclamation. Anyone want to take care of that?
Do we gotta approve the agenda first?
Oh, I'm sorry. It was called to order, and I guess we should approve the agenda. Thank you, Bobby. You're very helpful.
I'll move it.
Okay, and so we have a motion to...
Good morning.
Oh, good. Good morning, Jenny. Can you hear us?
Yes, go ahead.
Okay. Any second?
Second.
Okay.
So, if we could, excuse me, point of
Sure.
order, since we're doing things over speaker, and Jenny is not with us, if whenever someone says something, if they could say, this is Rena, but, well, you could say this is Andrea, but I would say this is Rena.
okay.
And also, we'll be doing roll call votes. And
Okay.
any votes, we'll need to do it that way so that we make sure that everyone on all sides knows who spoke and who seconded and who did all of that.
Sure.
Sorry, I just,
Okay,
it's
so...
new way of
Yes, thank you.
operating.
So we have a motion and a second, and we'll have a roll call vote on approving the agenda. All those in favor signify. Bobby, aye.
Bobby's aye.
Myron, aye.
Andrea, aye.
Roger, aye.
And it passes.
Jenny?
Jenny?
Jenny, aye.
Thank you.
Aye.
Okay, approved. Then let's go to the proclamations.
Would you like me to read those,
Who's
Commissioner
going to do
Christian?
that?
I'd be happy to read those.
Thank you.
So the first proclamation that we're bringing before the board this morning is to recognize the month of March as Social Work Month in Cook County. This is a national designation today. In fact, March 17th is World Social Work Day. So thank you to the board for considering this proclamation today to recognize the work of our social work staff in Cook County. The theme for this month is Social Workers, Generations Strong. Whereas the social work profession for generations has worked to strengthen the well-being and meet the basic needs of all people, especially people who are vulnerable, oppressed, and living in poverty. Whereas this year's Social Work Month theme, Social Workers, Generations Strong, embodies the heroic work of social workers who for more than a century have worked to make our society a better place to live. Whereas the social work profession is a diverse profession that allows people of various generations, ethnicities, sexual identities, and religious backgrounds to make an immediate positive impact on our nation and world. Whereas the social work profession is one of the fastest growing professions in the United States, with more than 777,000 people expected to be employed by social workers by 2028. Whereas social workers work in all parts of our society to meet people where they are and empower them to live their fullest potentials. Whereas the social work profession, more than many other professions, has expansive boundaries that allow social workers to work in a variety of settings, including schools, centers for veterans, the military, hospitals, and mental health centers, corporations, and local and state and federal government. Whereas social workers for generations have worked with other professions, community groups, lawmakers, civil rights, and other organizations to bring equal rights for all, including women and people who are African American, Latino, Native American, LGBTQ, and of various cultural, ethnic, and religious groups. Whereas the social work profession has been in the forefront of pushing for changes that have made our society a better place to live, including a minimum wage, improved workplace safety, and social safety net programs that help ameliorate poverty and hunger. Whereas social workers have been and continue to stand ready to help our nation in times of crisis, including war and natural disasters such as floods, earthquakes, and hurricanes. Whereas social workers stand ready to have the expertise to help our nation handle some of its most pressing issues, including equal rights for all, improved health care and mental health care for all, immigration reform, income inequality, and the environmental impact of climate change. Now, therefore, in recognition of the numerous contributions made by America's social workers, I, Allison McIntyre, on behalf of Heidi Dukirk, Public Health and Human Services Board Chair, proclaim the month of March 2020 as National Social Work Month and call upon all county citizens to join the National Association of Social Workers and the Cook County PHHS Board in celebration and support of the social work profession and social workers throughout Cook County. I'd initially asked our social work staff to come down and be recognized by the board, but in light of recommendations for community mitigation, they will be hopefully watching in from their office or will receive other recognition.
Our chair is here, so I'll just turn the meeting over to her. Commissioner Dukirk, we just did the social work month proclamation, so we're on B under proclamations.
Okay. Good morning, everyone. Sorry, technical difficulty. Obviously, I can drive better than I can use phones and electronics. Yes, you heard that, anyone that wants to make fun of my driving. I would like to move B down to just before the staff report, since that's what our staff report is about, if you all don't mind, and move into the consent agenda. Is there anything that anyone would like to add or change on the agenda? Okay, so with that, I will need a motion to approve the consent agenda.
Andrea motions.
Andrea motions. Do I have a second?
Myron, second.
Okay, and then what I'll do is I'll go down if you just want to say yes or no. Andrea?
Andrea, yes.
Roger?
Yes.
Ginny?
Yes.
Thank you. Myron?
Yes.
Dave? Not
Babysitting.
in it? Bobby?
Yep.
And Heidi, yes. So with that, we have no Dave and all the rest a yes on the consent agenda. Then we will move into staff report with Grace Bouchard, but before that, I will read to you the Child Abuse Prevention Month proclamation. Whereas in federal fiscal year 2018, 4.3 million reports were made to Child Protective Services, and whereas child abuse and neglect is a serious problem affecting every segment of our community, and finding solutions requires input and action from everyone. And whereas our children are our most valuable resources and will shape the future of Cook County, Minnesota. And whereas child abuse can have long-term psychological, emotional, and physical effects that have lasting consequences for victims of abuse. Whereas protective factors are conditions that reduce or eliminate risk and promote the social, emotional, and developmental well-being of children. And whereas effective child abuse prevention activities succeed because of partnerships created between child welfare professionals, education, health, community, and faith-based organizations, businesses, law enforcement agencies, and families. And whereas communities must make every effort to promote programs and activities that create strong and thriving children and families. And whereas we acknowledge that we must work together as a community to increase awareness about child abuse and contribute to promote the social and emotional well-being of children and families in a safe, stable, and nurturing environment. And whereas prevention remains the best defense for our children and families. Now therefore, I, Heidi Dukirk, Public Health and Human Service Board Chair, do hereby proclaim April 2020 as National Child Abuse Prevention Month in Cook County, Minnesota, and urge all citizens to recognize this month by dedicating ourselves to the task of improving the quality of life for all children and families. And with that, it's yours, Grace.
Thank you. Today first of all, I'm Grace Bouchard. I'm the supervisor of the Family and Children's team, and that includes Child Protection Services, Children's Mental Health, Child Welfare, Parent Support Outreach Program, Adult Mental Health, and Chemical Dependency team. And so my purpose today is to talk about one aspect of child protection, and that is specifically the Child Protection Team model. And it's how we work together as a community to provide support to each other and provide case consultation around issues related to child protection. Let's see. Pardon me, I'm just working this now. Let's see if I can get to the next. I'm just going to go this way.
It's only because I'm here, Grace.
Well, we always say the power of 2, but now I've got the power of about 8 here. I don't know if that's helping. Why is this not moving forward?
Sarah has magical powers.
Hang on, maybe I'm just doing the wrong. I know Sarah's magic cost.
I don't know about that.
I did have that pushed, and so. Can we just go back to the non-slideshow and I can just have it present this way?
That's really weird.
I just talk people through it.
So I'm just going to save it and close it and we'll start over.
There's CPT. And I think, see what happens.
There,
Now it looks,
There you go.
Yay, thank you, we knew she's magic, thank you, Sarah. The Child Protection Team supports an effective response to child maltreatment. Minnesota statute provides for the formation of a multidisciplinary team to respond and to provide support for child protection. The team provides public and professional education, and oftentimes during Child Protection Abuse or Child Abuse Prevention Month, there's articles that go out, flyers that go out, etc. This year we have an article in the paper, but we haven't. In the past, we've done the pinwheels for children, and we didn't do that this year, but those are the kinds of things that we do. We also offer trainings. For example, approximately 2 weeks ago, there was a training on child abuse for non-medical people where it specifically looked helped people walk through what to identify and what to look for from a medical aspect when working with children, things that we typically don't look for. That was a training that was provided in Carleton County, and a team of us viewed it here in Cook County, and that included somebody from law enforcement, somebody from early childhood, family education, and social work staff. So we worked as a team and functioned as a team to learn together. And so those are the kinds of things that we can do. We develop resources for prevention, intervention, and treatment. There are a wide variety of things that we have done in the past, and currently we continue to look at how to build more resources for parenting education, because we have a strong belief that as parents learn and grow and develop skills in parenting, they're less likely to use harmful methods to discipline or respond to their children. It also provides case consultation to local welfare agencies, and that is the purpose of our meeting once a month. We meet as a team to discuss complex situations and determine whether or not there's resources available to people, or to the team, to our agency, to best support the family. I think it's really important that our agency never works in a vacuum, and that we get resources and resource information from the community at large, so that we're making the best decision for the family. The committee may include, but is not limited to, directors of the welfare agency, county attorney, county sheriff, health departments, representatives from mental health, and parent groups. And we have had a fairly consistent team over the last 30 years. The only entity that we've added to our team is the Early Childhood Family Education Help Me Grow. And in part, it's a new program, and those are children that are vulnerable, and so we wanted to add them to the team. All participants sign confidentiality statements, and just to note that the conversations are not recorded, they're not documented, and that they're not subject to discovery. This is consultation so that we can best address the needs of the family. As I said, Cook County team has been meeting for over 30 years on the first Thursday of the month. Almost all the same agencies have been represented. We've had a great turnover in the representatives, though. For example, for those of you that recall, Steve Borrud used to represent probation. Jody Uhasi from the Violence Prevention Center was a long-term member of the agency, or of the team. Various others. Roger was part of that team for quite many years, and so we just have had a really great team. And we're working to build and develop our current team. Again, through a process of consultation and education regarding resources, the team has been able to develop trusting and long-lasting relationships that really benefit us in all aspects of the work we do. So case consultation is defined as a case review process in which recommendations are made. So for example, if we're working with a family with a young child, and there's somebody present from early childhood family education or the clinic, they may say, maybe you want to have a doctor's visit, or maybe you want to refer in this direction. It provides us guidance and support, and we really appreciate that. And again, the guidance can be provided as a subcommittee or a child protection team, and that's beneficial too, so that we can consult. So why do we work as a team? Because it's really important to work as a team to reduce secondary trauma. Over the last several years, there's just been more research indicating that compassion fatigue and secondary trauma are something that individuals working in the field of child protection and many of the areas of human services are affected by. There is also another term, moral indignation. I think that those of us that believe in the care and welfare of children can be very worn down by seeing children and families, but children treated in harmful and damaging ways, and it does wear people out. And so if we work as a team, we can support each other and help with the grief, with the loss, and the feelings that we experience. And empathic strain is one of those feelings too. So we love working as a team because that's one place where we can really talk about things. We can't go home and talk about these things. We have to talk to each other, and it's really great to have a safe place to talk about it. So I wanted to provide you with a summary of 2019, the intakes that we received. So in the year of 2019, we received 84 intakes related to child maltreatment. The number of children related to the reports is, and that is the specific subject of the report and their siblings, came up to 126. So 126 children were part of the families. If you took this,
Hang on a second. Excuse me, who else is on the line besides Commissioner Storley?
Just me?
Okay. Technology.
it's exciting.
It's the Palladians.
So when we look at this number, 126, oftentimes the call comes in and we have one child of the family where the report is made. But if one child in the family is being harmed, all the children in the family are at risk, and it's a vulnerable situation for all of them. So if you look at the number 126, represents all the children in the families where reports were received. So based on the current number of children in Cook County, and that's 808, which is
If you're on this
I've
line,
got something else going.
if you're on this line and you are not,
I don't know.
and you are not Commissioner Storley, please hang up.
Yeah, I'm on.
No, I know.
Yes, I'm on, but I pushed the wrong button.
Oh, okay. All right, thanks.
Yeah. Yeah, we're good.
So in Cook County, there's 108, based on the last census, which is quite old at this time, but based on the last census, there were 808 people under the age of 18, and so the percentage of children that were affected by child maltreatment in Cook County was 16%. And this is fairly steady percentage-wise based on the last year's report and the report the year before. Additionally, we had 14 referrals made to children's mental health services, and this is notable because state law states that we can, a children's mental health case manager can have 16 children on her caseload, on their caseload. I said her because in this case, our county, Jade, is our children's mental health case manager, but on a case, only 16 work groups can be open for an individual case manager. That's because the needs of children with mental health needs are very complex. You're working with families, there's very limited resources, and if that child has to be placed in out-of-home placement, there's a requirement to see that child once a month in their facility and meet with them. Obviously in Cook County, almost all those placements are out of county and are far in a field, and so that requires travel and such. So we, the limiting of case work groups is indicated. 13 families were referred to the Parent Support Outreach Program, and this is a relatively new program to our county, but it's a really wonderful program. It's a program that's preventative. Anybody can make a referral to a Parent Support Outreach Program. A family just needs to have a child age 10 or under and have risk factors. And a risk factor can be a previous history of child maltreatment or perhaps chemical dependency treatment, at risk for homelessness, poverty. Parent Support Outreach Program might be a very valuable program at this time when people are losing their jobs and they aren't able to care for their children. I know that there's a lot of things going on to perhaps mitigate people being evicted, but Parent Support Outreach Program has really worked closely with families to prevent a lot of struggles. And our county receives funding from the state to be used for services, and so we can pay for deposits, we can offset the cost of a car repair, those kinds of things that help a family move forward. And I know sometimes we've had people, we provide that one opportunity of assistance, and that's the last we ever hear from them because they were just stuck. Maybe their car was broke down, and if your car isn't working, you can't get your child to therapy, you can't get your child to school, you can't get to work. All those things that can fall apart pretty easily, and so by providing this service, which includes case management and one-to-one support, we really build trusting relationships and prevent things to become more complex. 3 children were referred to child welfare services in our referral process, and basically that's the parent support outreach program where kids are over 10 years of age, and so there just isn't a funding stream for that, but we still provide support and services through case management. So again, our agency philosophy is always to work with families, keep families and children together, and support family strength so that they can grow in the best way possible. And we try to keep parents and children together, and we always look to work for strengths. And so we have a strong team model, and we really work together as a team, and I really appreciate so much everybody who provides the help and support so that we can provide services. And I'm very grateful for the Child Protection team, the people in our agency, and our community members far and afield. So thank you.
Okay, does anyone have questions for Grace?
Yes,
Myron?
thank you. You mentioned the 16%. Do you know what the state average is?
I don't. That's a good statistic. I will look it up.
Okay.
Thank you for that question.
Seems about right, but it's always good to look at that, and
Yeah. It's a very good point. I don't know.
especially resources and those kinds of things.
Yeah.
Thank you.
Ginny, did you have any questions?
No.
Anyone else have any questions? What is the response plan with the school closing, since that's often a resource for youth to get a hold of our staff?
Yeah, that's a very good question, and it's evolving, and we're waiting for guidance from the state. But we are required, so some of the things are on our continuity of operation plan that indicate that we are a mandatory service is to respond to any intake reports within 24 hours. We're required to screen together. We do team screenings. We don't screen alone, again, so that we make the best decision possible. And I just want to say also that if a family or a child is connected with Grand Portage or a tribal community in any way, we contact Grand Portage so that we make our screening decisions in concert with their agency. And then depending on the type of report, if it's an investigation, we're required to make a face-to-face contact within 24 hours, and that's for serious maltreatment or sexual abuse. And then if it is a concerning report but not imminent risk of harm, we're required to see those children within 5 calendar days. And so you're right, with no school, it makes it more challenging to connect with kiddos and to talk to them. Sometimes we need to talk to the children before talking to the parents so that they feel more comfortable and safer. And we can make a determination whether or not they should go home, whether they're at imminent risk. Mm-hmm. So we just have to, there's some discerning that needs to go on in that area yet.
Yeah, because there will be added stress during this time, so just a reminder to anyone that's out there, be kind, be compassionate, and remember that we're all doing the best that we can, and so try not to judge your neighbors, and try to be that helping hand at a safe, personal distance. Thank you, Grace.
Thank you.
Thank you, Grace.
Thank you.
So then we have public health emergency preparedness
Sarah,
update.
I'm sorry.
Just click on the little Google guy at the bottom.
Google guy. Got it. And there we are. I did that.
So you want me to move the microphone for you? All right. So Ginny, we have Grace Grenager now up.
Hi, Jenny. So I am going to give some brief updates as to what types of things I've been working on, and what kinds of things that I'm trying to do right now with all that's happening with COVID-19 in the community. One of the things that I'd like time for discussion for at the end is just, as Rena sent out in her email last week, a conversation about how you would like to hear from me and what types of updates you would like from me. Just knowing that there's a lot happening very quickly, and I want to make sure that we are being prompt and getting you the information that you need to do your jobs well at this point in time. And just realizing there's a lot of information flying out there. So I want to get some support from you in knowing the best way to communicate with you all during this time. So I'll run through a couple of things, and I'm going to invite Mike Keyport to also speak to the emergency management piece of the response. So right now, as of last Saturday, I've been having daily meetings with North Shore Health and Sawtooth Mountain Clinic using the incident command structure to make sure that the healthcare campuses and public health are all aware of any changes that are happening related to coronavirus. I am also getting regular updates from the Northeast Healthcare Preparedness Coalition, which is a regional group that includes hospitals, clinics, emergency response, and public health. They're doing quite a bit at bringing together regional updates and are working very hard with healthcare partners to ensure, to the best of their ability, that our healthcare partners have the personal protective equipment they need to do their jobs well at this point in time, which is a national supply issue. But there are support in that regard. And they're also doing regional inventories of ventilators in hospitals. So they're emailing me every few days at this point, just with updates as to what they're working on, and primarily are getting information from our clinical partners as to what we need here in the community. I've been very involved with public communications, both going on the radio, speaking. There was a panel, it seems like quite a while ago, but it was actually last Wednesday with the business community, with that between myself, the infectious disease specialist at North Shore Health, Jennifer Dowden, and the medical director at Sawtooth Mountain Clinic, Dr. Terrell, to talk to the business community about coronavirus and what it might mean for businesses. I've also been doing quite a bit of one-on-one communication with staff and community agencies and individuals who've reached out to me with questions. A few of the key messages that I'm trying to put out there in the community. One is the very basic messages that everyone has heard multiple times now, but bear repeating: the washing your hands, the covering your cough, staying home when you're sick. Another is that travelers returning from overseas or from an area where there's high risk, in other words, there's widespread community transmission of coronavirus, upon returning to the community, should be staying at home for 2 weeks and monitoring for symptoms as a precautionary measure. That was something that was talked over between now the interim medical director is Kurt Farshman and myself and staff at North Shore Health as part of our incident command meetings in the mornings, that this is a very conservative measure to make sure that if folks have been exposed to coronavirus, that they are staying home and so that they are not spreading the virus within the community. So that message has evolved. At first, the message was just international travelers coming from high-risk countries. The message has evolved to anyone coming from a high-risk area, whether that's overseas or within the country. The other message is social distancing. So other communities who've experienced the spread of coronavirus, who've really taken ownership over the idea of social distancing, have fared better. And so that's the idea that you stay 6 feet apart from other people in public places. Or if you're caring for someone at home who is quarantined, or in isolation, that you're staying that 6 feet away from that person. So that idea is something that I'm looking to really amplify in the community, because I think it's new to people, especially, you go to the grocery store, you go to the mail, get your mail, it's a crowded space. So trying to find ways that people can really operationalize that in their daily lives, that's another message that is key at this point. Let's see. Another thing the board should be aware of, another matter, is that the county has a statutory obligation to provide what are called essential services to people in isolation and quarantine. And that means anything that individual would need to maintain that isolation or quarantine status. So whether it's helping make sure that they have food, making sure if they have animals that there's someone caring for their pet. There are levels of quarantine and isolation. The level at which we would be required to provide these services is when the Minnesota Department of Health contacts me and says, there's someone in your jurisdiction who is in isolation or quarantine. You may be asked to provide essential services. So it's a different level than that if you're coming from a high-risk area, we're asking you to voluntarily self-quarantine. These would be people who are required to be in quarantine, and that would be communication between myself and MDH. I don't get the individuals' names. I get a message from MDH that says, if we need your assistance as the county, we will reach out directly to you in the public health department. And that's something that we have a plan written up for, and I actually received my first notification that there is someone in the community that's under that level of quarantine last night. So that's something that we should be thinking about providing in the very near future. Also, something that happened yesterday, the state has a system called Minnesota Responds. It's a volunteer management system that can be used in emergencies. Yesterday, the state authorized use of Minnesota Responds. And so one of the things I will be working on today is figuring out how this system can be best used within Cook County. I know there are a lot of people who want to help, and I appreciate that, and I'm hoping we can put some structure to that so that people who are having that desire to help are doing so in a way that's safe and structured to some extent. Again, being cautious and trying to prevent the spread of coronavirus within our community. The last thing I will mention before bringing on Mike to speak to a few things together with me is just recognizing that we have gotten a tremendous amount of support from Sawtooth Mountain Clinic as we formulate preparedness and response plans. They have been willing to have staff providing staff help with some of that messaging, supporting some questions for people who are in isolation and quarantine. The amount of support coming from the clinic administration has been really wonderful, and I'm very appreciative of it, and I assume that is something that will continue in the coming weeks. So I wanted to recognize that support as being something that's really critical to our being able to provide these services and set up this framework within a very short time frame and with very limited staffing. As you all know, the public health and human services is largely me, although I do feel very supported from Allison and all of my colleagues in PHHS at this time. The last 2 points I would like to discuss, and I'll bring Mike on for these as well, is planning for what we will do when we get our first positive case of coronavirus within the county, what that communication will look like, and then talking over how or when we might declare a state of emergency within Cook County related to coronavirus. And some of these are outside my area of expertise, which is why I'm very grateful for also the partnership with Mike Keyport and the Emergency Management Department. So when we get our first case, the way that testing works, we can send specimens from labs here locally. They all go to the Minnesota Department of Health. That is changing somewhat as they're bringing on more capacity with commercial testing through commercial labs at this point. But right now the tests go to the lab in St. Paul and the results come back within 2 to 3 days. So if there's a positive test, I get a call from the Minnesota Department of Health immediately, and I'm assuming the ordering provider also does. And then that would be when that isolation and quarantine and that statutory obligation to provide essential services for those folks would kick in. So to clarify, quarantine is someone who has been exposed to coronavirus, and that is known, and isolation is someone who is tested positive for coronavirus and is staying home. And so that first call or contact will come from the Minnesota Department of Health to me. I will likely be then communicating with Mike, Allison, and Rena and the commissioners, and then setting up some way to put that information out in the community. That's as much of a process as I have at this point in time. So if there are other suggestions for how to roll that out or think about that, I welcome that support. Mike, do you want to speak to the emergency management piece?
Mike, can you come up, because we've got one on the speaker.
All right. I'm still available for questions, but I'm going to leave the mic to Mike.
Good morning to y'all. As you might likely know, the norm throughout our region and out the state is that being how this is a public health emergency, that public health takes the lead with backup, if you will, from emergency management, and that's what we're doing here in the county. Grace is doing a great job. A couple of the questions that have come up in the emergency management side of things is if we're going to open an EOC, and my answer to that today or right now is no, simply because Grace and I and Allison and Rena and the other players here are kind of got our hands full, and I don't think we could staff it 8 hours a day and continue to do the work that we need to do. Secondly, as Grace mentioned, the state of emergency, there's a little bit of confusion to that. I was on phone calls most of the day yesterday as to what other counties throughout the state are doing. And the answer is some are, some aren't. I did talk to our regional program coordinator just before I came over here, and his suggestion is to just do it. You're better off to declare the emergency now, and whether it helps you or whatever, that was his recommendation. I don't know if there's a trigger, if it has to be done today, or it could wait till next week's meeting rather than trying to get the Board of Commissioners together for an emergency meeting, but we can discuss that further if need be, but the recommendation is to declare an emergency, a public health emergency. I met with the Grand Portage Tribal Councils and some of their department heads yesterday morning, and their decision was to declare emergency, and they did do that yesterday. So I know of 2 other tribes that did it, and only 2 other counties in the Northeast region as of this morning. So I would recommend that we just declare the emergency.
What does it mean to declare an emergency?
Basically, it's a formality. It's just a declaration that's approved by the Board of Commissioners.
And Molly, does that have to be posted?
Your question is, does it have to be posted? Mm-hmm. I don't think that there's a requirement that it needs to be posted. That would probably be contrary to the usual emergency nature of it. But right now, I will take a look at the statute. I know which statute to look to. I think it's just a matter of using the right language. Mm-hmm. And I can have that prepared in time for the Committee of the Whole meeting today at 10 o'clock.
Yes. And we can do that during Committee of the Whole when we don't normally take action during that meeting?
It's going to be up to the commissioners if they want to take action. I know that there will be a recommendation that the agenda for the committee of the whole meeting change and that we make an exception to the normal rule that there's no action taken at the committee of the whole. Open meeting law does not require the commissioners to publish an agenda. It's definitely our practice most of the time for transparency, but sometimes other things need to take priority. This is probably one of them, if it's the commissioner's desire to declare a local state of emergency.
Okay, and if we can do it at this meeting, since we're all present. But that gives you a little tiny window. Either way.
Because in a normal situation, I last October did it for the Grand Portage Tribe when they had a weather event. What it would normally look like is the county or the tribe would declare an emergency, and it moves on up to the state, and then the state would declare a state of emergency. Being how that's already been done, we're kind of doing it in a backwards fashion, but it's still, I think it would behoove us to move forward with it.
Okay. Any questions for Mike? Andrea?
Is this an appropriate time to ask what sort of resources would be available in a state of emergency? I guess I'm not.
The answer to that is that any outside costs that we are, like for Grace and I, for instance, working extra hours, that may be reimbursable from the state to and not only hours, but anything else that's being done in the county that is incurring a cost to the county would likely be reimbursable from the state. So I've been advised from Homeland Security and Emergency Management to track all of our costs, anything that we're doing outside of our normal scope of duties. So,
Ginny, do you have any questions?
I do not, but I'm glad to hear that that will be called.
Okay. Any other questions, Rena?
Mike, I'm just wondering, we've been purchasing a lot of laptops to send people home. Would that be a reimbursable expense?
I'm certain it would
Okay.
be, Rena, yes.
Good. Then we will, I'll ask the IT folks to keep track of that.
Yeah, for sure. Anything that's out of the normal scope of what we do on our daily basis, so.
All right. And then Grace, you had questions for us that you wanted answers? Thanks, Mike.
Thanks, Mike.
Thanks, Mike.
So my primary question is, at what level would you like me to be communicating updates with you as commissioners, and which type of updates are, I guess, a priority for you all to be able to make decisions and do your work? I can use my best judgment, but if there's anything you would like to let me know at this point, I welcome that.
Bobby?
I'd like a daily update on it anyway.
Myron?
Yes, I think use your discretion, but daily would be, or if we don't hear anything, nothing has changed, but
Sure.
I also would like to commend you for the work that you are doing, and part of that is to be available to the other resources that we have that are involved, state and federal. So, but I think you've done a great job so far, and so thank you for that.
Thank
Ginny?
you.
Yes, ditto here. Thank you very much.
Would you like daily updates?
Yes.
Sure. I think what I'll plan to do then is, because these ICS meetings with the clinic and the hospital are basically the updates that I have, I might just look at those and then send them to the commissioners afterwards as well, and as well as any other relevant information that's county specific.
And then can you please leave me out of all updates unless there's something critical?
Yes.
The updates just make me ill. Sorry. Just going to be
Okay.
honest. Go ahead.
So this is Rena, Jenny. I'm just wondering if it would be acceptable, commissioners. I know that Grace is extremely busy sometimes, and I'm sitting in those meetings too. If she doesn't have time to send you the updates, if it's okay if I just continue to try to keep you, so that you're getting an update from somebody, I guess is Is that okay with everyone? Okay.
All right.
Okay, that's all I have for you.
Thank you. Director's report, Allison. As she furiously types away.
She is fast.
Yes.
Just again want to extend my thanks and appreciation to Grace for the work that you're putting in and your professionalism and your calm nature. Grace was on the radio again this morning, really doing everything she can to help get the most timely information out to you all as decision makers, to our staff within PHHS who have an essential role and are serving a very vulnerable population, as well as to the community as a whole. So thank you, Grace.
Yeah, I had a call yesterday. How many ventilators? How many ICU rooms? How many? I'm like, we are well equipped to handle the situation to the best of our ability.
So for my updates today, I'll just expand a bit on some of the work that we're doing in terms of continuity planning and identifying priority areas within our department. I want to thank Rena for giving each of the department heads a really great tool to use as a framework for thinking through how we deliver services and what are the most essential services that we're delivering. We're fortunate in Public Health and Human Services that we had a continuity of operations plan that we could draw from. There are some updates that we're going through and making to this plan just to ensure that we're considering all essential services and planning for what service reduction might look like within the context of our department. We're really doing as much work as we can by phone, conducting meetings through Skype, things like that to meet those recommendations from the state for social distancing. Many of our staff have young children that are in school, so that's an important consideration for us as well, how we can allow for teleworking, how we can stagger shifts, and how we can really accommodate our staff and their needs, as well as the needs of the people that we serve in the best way possible. I just want to call out and recognize Sarah Schoonover, who's here this morning. Sarah is a member of our front office team, a case aide who primarily serves our income maintenance programs. Sarah is learning the ropes with agendas and minutes so that she can be a backup to Sarah as Sarah takes on more of a role in social services. So again, doing what we can internally to really add depth and have coverage where possible.
So no matter what, Sarah will take care of it.
It will be a Sarah. You can
Just
trust
have
in
to remember
Sarah.
one name.
That's weird.
One or the other, you know?
Is that Sarah A.H. or Sarah A?
Just Sarah A.
Okay, so
Just
that's
Sarah A.
Sarah A squared.
Yeah.
Under items for board action, there's one item that I wanted to call out in particular and give a little more information. You have before you a request for temporary employment of a case aide. Linda Waterhouse, who's a former social worker in PHHS, has agreed to come on and provide temporary support to the department for no more than 6 months during staff maternity leaves. Last month when I was before you, I said that we had no immediate plans to bring on a backup social worker. But after talking through with the team and learning that Linda, who has a wealth of experience and familiarity with the programs, with our staff, with our services, and having her agree to come on in a more of a support role, it felt like a really great solution for adding depth within our team in the short term. That with Linda coming on as in a case aide capacity, that she can really support the case managers who are remaining in the office, help people stay in the office when possible. She'll be able to do things like transports, work with clients that can really free up those case managers to do to continue to provide the level of service that they need to their clients without having to do a lot of transfers or handoffs of reassigning cases. Also want you to be aware that the 2 public health positions will be going before the Personnel Committee this afternoon. That includes the position that was included in the 2020 budget, a public health educator position that would report to Grace to provide support in community health assessment work, as well as some backup emergency preparedness.
Grace B?
Grace Grenager.
Okay.
So this will be a health educator position.
Okay.
PHHS, as you know, traditionally had 2 public health nurses for many, many years. When we were providing family home visiting services, at the point that we transitioned the nurse home visiting program to the Sawtooth Mountain Clinic, we held off on filling that position. And then as a part of our 2020 budget proposal, proposed re-adding a position, but at a health educator level to provide some support and depth within the public health unit. As Grace said, she really is a department of one, and there's no better time than now to demonstrate the need for having depth in that area.
Okay.
So those will be reviewed by personnel. Again, the new public health educator position, as well as changes to Grace Grenager's public health position, changing her classification from a public health coordinator to a public health supervisor, as she will be the supervisor of this position. The plan is for Pam Dixon and HR to bring those before the Board of Commissioners at your meeting later this month.
Great.
Lastly, I just wanted to elaborate a bit on our World Social Work Day recognition for staff. Again, I had originally asked staff to come down and be recognized. So I just wanted to take a quick moment to name each of our social services staff and recognize them individually. Within the All Adult and Home and Community-Based Services team, this is the group of staff who serve our eldest population, as well as those with disabilities, both here in the community and those who are county residents who are receiving services in perhaps a group or supported setting outside of the community. So the supervisor of that area is Martina Johnson. Martina is one of our longest serving employees in the PHHS department. And within the team of Adult and Home and Community-Based Services, we have Lynn Wright, who is an Adult Services Care Coordinator. He's also one of our adult protection workers. Beth Benson is also a care coordinator, and she is one of our assessors for the Min Choices program, which is a service that determines what types of services people can receive, for example, in our care center or in the community. Julie Kinney is the case manager for persons with developmental disabilities and is also an assessor for Min Choices. Olivia Bonander is another adult services case manager and one of our adult protection workers. Anita Josiah coordinates our in-home support program and is also a key member of that team. And Elissa Smith is a social services case aide, who is another really important part of the team in terms of doing a lot of the data entry that's required to ensure funding for some of these programs. Within the Children and Family Services team, you all saw Grace Bouchard this morning. Grace is, again, one of our longest serving employees in PHHS. Within her team, Cooper Turnus is one of the primary child protection social workers. Anna Axtell is our adult mental health case manager. Heidi Akins is the intake social worker, so she is really our front lines in terms of meeting with people in the office or on the phone when they're originally reporting concerns or requesting services. Heidi also administers the PSOP program that you heard about this morning, the Parent Support Outreach Program. Jade Woltman is the Children's Mental Health Case Manager, working with children in Cook County or in placement outside of the county receiving services. Reed Watson is also a member of that child protection team, one of our primary investigators and case managers, and also works in the PSOP program. Matthew Baxley is a member of the mental health services team as a community support provider. And then Sarah, as you know, is taking on a much larger role as well in the area of substance use disorder treatment coordination as a really important part of that team of social work professionals. So thank you to all staff.
Thank you to all staff.
As far as agency updates, I just have a few, just one brief update actually, to say that I just learned that a federal judge blocked the SNAP changes that were proposed to impact the Grand Portage Reservation, in particular locally, and those were changes to the able-bodied adults without dependents. So that has been blocked, really in the light of the emerging concerns with coronavirus. So I
Awesome.
don't have any updates on the other proposed federal changes
Okay.
at this time.
Thank you.
And then I would just open up any other questions beyond the temporary employment agreement for the items for board action.
Does anybody have questions? Ginny, do you have questions?
No, thanks.
Okay. We'll move on to items for board action. Item A, can I get a motion?
Andrea motions.
Andrea motions.
Roger, I'll second.
Roger seconds. So we will go with roll call. If you could just say yes or no. Andrea?
Yes.
Roger?
Yes.
Ginny?
Yes.
Myron?
Yes.
Bobby?
Yes.
And I am a yes. That is all yes for item A. Item B, Child Support Program Cooperative Agreement. Can I get a motion?
So move.
From Myron and a second.
Andrea seconds.
Andrea seconds. We'll do a roll call again. Andrea?
Yes.
Roger?
Yes.
Ginny?
Yes.
Myron?
Yes.
Bobby?
Yep.
And I am a yes. That is all yeses. Item C, North Shore Collaborative Joint Powers Agreement and Resolution. Can I get a motion?
This is Roger, I'll move it.
Can I get a second?
I'll move it.
Bobby seconds. And we'll do a roll call again. Andrea?
Yes.
Roger?
Yes.
Ginny?
Yes.
Myron?
Yes.
Bobby?
Yep.
And I am a yes. That is all yeses. Item D, approval of Public Health and Human Service Advisory Committee bylaws. I will make the motion to pass that. Can I get a second?
Myron, support.
Myron is the second. We'll do roll call again. Andrea?
Yes.
Roger?
Yes.
Ginny?
Yes.
Myron?
Yes.
Bobby?
Yep.
And I am a yes. That is all yeses. Item E, approval of Cook County Local Advisory Council for Mental Health bylaws. Can I get a motion on that?
This is Roger, I'll move it.
I'll second it. So that's Roger motion, Heidi second. We'll do roll call again. Andrea?
Yes.
Roger?
Yes.
Ginny?
Yes.
Myron?
Yes.
Bobby?
Yep.
And I am a yes. That is all yeses again. F, Sawtooth Mountain Clinic contract addendums. Can I get a motion?
Myron, move.
Myron moves it.
Support.
Bobby seconds it. We will do roll call again. Andrea?
I don't think I can vote since I work there.
You're abstaining. Roger?
Yes.
Ginny?
Yes.
Myron?
Yes.
Bobby?
Yep.
And Heidi, yes. So that is all yeses and one abstain for Andrea. And the final item G, approve James Zimmer as member of Cook County Local Health Advisory Council. I will move that. Can I get a second?
Yes.
Roger seconds. And we will go down the line again. Andrea?
Yes.
Roger?
Yes.
Ginny?
Yes.
Myron?
Yes.
Bobby?
Yep.
And I will say yes, that is all yeses. Excellent. We should do that every time. Wasn't that fun? All right, committee reports, Arrowhead Economic Opportunity. Ginny, did you go for Dave?
No, I wasn't here.
Okay. Arrowhead Health Alliance, was that the one you and I went to?
It
Yes, I did go to that one. That was a strategic planning one. And if you've got any updates, it was just basically we went over the history and what we're doing moving forward, and I think it's just the beginning of the process.
Yes, a lot of talk about what the role is of the AHA and where we see potential to change and grow. Some of this related to known changes with how mental health initiatives are funded, how the Region 3 Arrowhead has really put a lot of energy into telepresence and the benefits that has brought to the region. But also talking about how can we continue to grow and continue to meet the needs that are increasing within our region.
Great. Arrowhead Regional Corrections, Bobby.
We're meeting Friday by phone.
Okay. Arrowhead Regional Development Council, Ginny.
We met last month, but nothing to report there. And this coming Thursday, we will meet with the call-in.
Okay. Okay, and Community Health Board.
I'm the alternate, and the meeting for Thursday has been canceled.
Okay. Public Health and Human Service Advisory, Roger?
We had a good meeting. We reviewed the, at that time, the latest in the emergency in the coronavirus and all the things related, and all the things related to that. Thanks, Allison. Talked about who's going to be doing what and all of that. So that has changed a lot since then. But we were, the thing that I came out of the meeting feeling is very confident in the resources and the people we have up here in dealing with whatever happens. And that was reaffirmed today by presentations today. Kate Serbaugh also gave us an update on the pharmacy expansion, which was good to know, and still trying to figure out how they're going to fit that all in there, but I guess it's going to work. And thanks to Allison for some additional notes here. She reminds me that Jen Sorensen attended the meeting as newly appointed Interim Health Services Director at Grand Portage. And Jen has been with the clinic for 29 years and has learned about all the committees that Paul has served on. She also is a person who went through her RN training here through Cook County Higher Ed, so that's pretty cool. She's been doing this quite a while, been an RN for quite a while. We also approved revisions to the bylaws that you just approved. We had a discussion with one of the members about resources for Medicare supplement plans and copays at the local pharmacy. Senior Linkage Line was identified as a resource to help with Medicare questions, which is an excellent resource. A couple things came up that I'd like to see on our May agenda if we have a May meeting, and that is the forest therapy program that's underway in Thunder Bay. Would be something interesting to talk further about. And it also came up during our meeting that there is a need for more emergency response volunteers. So maybe something we can help. So those are, if we meet in May, those are some of the things we'll hopefully be looking for.
And emergency response volunteers also came up at the...
That's it. It was at the LEC one.
At the LEC meeting.
You
Yeah.
one of you.
Yes, absolutely.
Sorry to steal your stuff there.
That's okay, that wasn't on my list.
And Andrea, update on the Cook County Local Advisory for Adult and Children's Mental Health.
Yeah, so we met on March 10th, and we also approved the bylaws, and also talked about the present status of COVID-19, and Grace Granager shared a fact sheet on stress response to COVID-19, which has been shared throughout the community since then. There was a webinar shared with the group and Cook County School Administrations called What the 2019 Minnesota Student Survey Data Reveals About ACEs, Protective Factors, and Resilience. So that was a valuable webinar that sort of spoke to what the ACEs data revealed on the student survey. To step back, in the COVID-19 discussion, there was a short discussion about gap in cell phone services in Hovland and how that gap could affect persons living out there and the level of isolation that they could experience. We also discussed how it would be helpful to know what the local schools are doing with their students through formal and informal channels regarding resiliency, well-being, and mindfulness. So that's something that we have, obviously, in the much later future now. And then we finished our meeting with a discussion of how we will approach a radio spot. We have the first Thursday spot in May for Mental Health Awareness Month, and what that conversation will hopefully look like.
Excellent, thank you.
Yeah.
Healthcare planning, Ginny.
Yes, we did meet as a small group. I guess the only thing I can give you is an update on the architectural plans for the pharmacy at the clinic. It's moving on, and they're pleased with what has come up with plans, and so things are progressing.
Great, thank you.
That's all I have.
And Dave did not tell me if North Shore Collaborative was meeting or not, so I did not attend that one. And Allison's squinting.
They meet every other month. I'm trying to think if it's been since our last February meeting. We have not met since the February PHHS board meeting.
All right, emergency preparedness, Myron.
Yes, so we're going to have a meeting at 2 o'clock by telephone conferencing today, and I will be involved in that.
Great. And then for the good of the order, I will just say to all, remember to be kind and take care of yourselves and take care of your family. And remember, even if you are healthy, wealthy, and wise, everyone is not. So practice social distancing and wash your hands, as annoying as it is that we say that. And with that, we will adjourn. Thank you.
Thank you. Myron,
Yes.
I'm going to take a break off my ear, and then I'll try to come on at 10 o'clock.
Okay,
We'll
very
just,
good.
we'll just leave it open, Jen.
Just leave it
So-
open.
And so just call back in.
Okay. Okay, thanks.
I'm fine.
As far as I know, yes.
Last meeting I was at.
Okay, so this one is, one of them you can sign and one you don't.
That's still a priority.